Hi, I am Manuel Roman Aguirre and I am co-author of the work entitled Liposomes and Gold Nanoparticles as Carriers for Indocyanin Green and its Potential Use in Photodynamic Therapy. This work was made among Universidad Autónoma de Guanajuato, Universidad Autónoma de Aguascalientes, and Centro de Investigación en Materiales Avanzados. Photodynamic therapy is widely studied today as an alternative for treatment of diseases such as some kind of cancers. Photosensitizers are molecules used in photodynamic therapy to induce the death of targeted cells by oxidative stress. In photodynamic therapy, the photosensitizer is put inside the cell. Reactive oxygen species are produced when the photosensitizer is irradiated with a specific wavelength laser, and such reactive species start oxidative reactions that led to cellular death. In this work, we use indocyanin green as photosensitizer in order to provoke the death of Paramecium tetraurelia. Liposomes and gold nanoparticles were used as carrier for the photosensitizer. Indocyanin green was put in contact with Paramecium tetraurelia culture by 4 ways: directly in solution, absorbed on gold nanoparticles, encapsulated in liposomes, and adsorbed on gold nanoparticles that were encapsulated in liposomes. The photodynamic properties of materials were evaluated by placing a sample of Paramecium tetraurelia culture on a slide. The live specimens were counted and registered. Then, an aliquot of the studied material was put in contact with a sample of Paramecium tetraurelia, and the sample was irradiated with red laser. The Paramecium tetraurelia mobility was observed during 40 minutes, and specimens that did not move after irradiation were considered dead. Gold nanoparticles were prepared following the Turkevich method. A solution of chloroauric acid is heated to 100 degrees and then cooled to 60 degrees. Then, a solution of sodium citrate is added in order to reduce the acid into gold nanoparticles. Empty liposomes were obtained following the technique of film hydration. First, a lecithin solution in chloroform and methanol is dried under vacuum and then is rehydrated using a buffer 7.4 pH of phosphate. Then the liposomes are self-assembled. In order to prepare liposomes loaded with indocyanin green solution was mixed with the buffer solution, and then the film was resuspended by sonication. Liposomes loaded with gold nanoparticles and with indocyanin green adsorbed in gold nanoparticles were obtained in a similar way, but first, the formation of the film, the lecithin and the solution with gold nanoparticles were heated to 40 degrees and then dried under vacuum. Then, the solution of chloroform and methanol with lecithin dried in this way were again vacuum dried and then sonicated with buffer solution. As explained before, for the photodynamic test, a sample of Paramecium tetraurelia was put in a slide. Then, the alive specimens of Paramecium were counted, approximately having 20 plus or less to Paramecium alive. Then, a mix of buffer phosphate solution and 20 microliters of the tested materials were put together with the Paramecium tetraurelia. Then the irradiation started, and the mobility of the specimens were followed during 40 minutes. As can be seen in Table 1, when no laser irradiation, there is no death of Paramecium tetraurelia. But when laser irradiation occurs, only indocyanin green and indocyanin green absorbed on gold nanoparticles and encapsulated in liposomes were able to kill all the paramecium tetrahedrilla. The other materials were not able to provoke the death of cells. In figure 1, we can observe better the population of paramecium tetrahedrilla during the irradiation time. We can observe that indocyanin green kills faster the microorganisms than the indocyanin green absorbed on gold nanoparticles and encapsulated on liposomes. And indocyanin green in liposomes without gold nanoparticles caused just a few deaths of microorganisms. In figure 2, we can observe that some green particles are inside the paramecium tetrahedrilla. These particles are indocyanin green, absorbed in gold nanoparticles and encapsulated in liposomes. Although indocyanin green is able to provoke the death of paramecium tetrahedrilla, we must remember that free indocyanin green is easily eliminated from the body, so is not useful for photodynamic therapy. With this aim, indocyanin green needs the use of a carrier, and when absorbed in gold nanoparticles and encapsulated in liposomes, it seems to be a good vehicle for this photosensitizer. The system, gold nanoparticles, indocyanin green, and liposomes seems to have a synergistic effect. It is probably that gold nanoparticles increase its temperature when the laser is irradiated. This increase is not enough to kill the cell, but is enough to destroy the liposomal structure, delivering in this way the encapsulated indocyanin green, provoking the death of microorganisms. Another important result is that all the materials are inoffensive for the paramecium tetrahedrilla when are not exposed to laser irradiation. This is important in photodynamic therapy since only the damaged tissue is irradiated, so there is no danger that if the material is accumulated in healthy tissue, a collateral damage occur. So this is an advantage against, for example, chemotherapy or radiotherapy that kills healthy and damaged cells.